my name is Camille Adair. Welcome. I am the Healthy Nurse, Healthy New Mexico Interest Group Chair for the New Mexico Nurses Association. And I'm here this morning in Santa Fe, New Mexico at the Hotel Santa Fe with the president of the American Nurses Association, Pam Cipriano, and Keith Carlson. Hi, Keith. Would you like to introduce yourself?
Hi, Camille. Yeah, this is Keith Carlson. I'm a board member of the New Mexico Nurses Association, and I am also here with Camille and Pam Cipriano. It's a real honor. And Pam, welcome, and thank you for being here in Santa Fe for Nurses Week.
Thank you. I'm really excited to be with the New Mexico Nurses Association and always glad to be able to come back to visit in New Mexico.
Oh, that's good. Well, we're keeping you hydrated.
Yes, very much so.
You're here at 7,000 feet.
Keeping me healthy.
It's
Thank
nice
you.
And dry. We'll set up a drip later. And it's great to have you here. And we know you had a hard time getting here last night with a delayed plane, and you were a real trooper and arrived and spoke with everyone and had some photo ops. That was wonderful. And you talked about Healthy Nurse, Healthy Nation. So would you like to give just a quick little snippet about what this means to you and how important it is to you?
Absolutely. Thanks, Keith. And I so appreciated everyone hanging around last night to greet me and have an opportunity to tell a little bit about Healthy Nurse, Healthy Nation. But first, want to recognize the New Mexico Nurses Association for your leadership in New Mexico Healthy Nurses as well, because that's a really important part of this initiative. This is a grand challenge, which is intended to make major social change in the country. We believe by improving the health of nurses, we will improve the health of the nation. Now, that's a long-term, audacious goal, but we really believe it's important because nurses are not as healthy as the average public. And we think that's not serving nurses well, and we know that that doesn't serve our patients as well. And every nurse wants to be as healthy as they can so they can take the best care of patients. So we're focusing efforts on bringing together partners across the country to look at how we can improve nurses' exercise or activity, rest, nutrition, safety, and quality of life. So 5 really important domains. There can be all kinds of fun challenges and resources that nurses take advantage of. They can create an interest group and share ideas and feedback with their peers, not just even in New Mexico, but across the country. Organizations can enroll to be partners with New Mexico and with ANA to really take a look at how they're moving the needle and how we're improving nurses' health. So this is a long-term project that is just getting off the ground, but we are extremely excited and so pleased that the New Mexico Nurses Association is working with us.
Thank you, Pam. How long have you been a nurse?
I've been a nurse 41 years.
So can you talk a little bit about that sort of a historical perspective, and have you seen changes around the health and well-being of nurses during your career?
There have been a lot of changes for the better. And some of them, again, we link back to society and what were the kinds of things that we did or didn't do. I can remember as an early nurse, smoking was allowed in hospitals. And of course, I was never a smoker. I was around one. My father had smoked for a long time, then just quit cold turkey one day. And so I never really liked being around cigarettes. But I remember distinctly, my coworkers smoking in the break room and how terrible that seemed. And so over the course of time, I was a pretty much anti-smoking crusader and in a chief operating officer role was able to create a non-smoking hospital zone in South Carolina, which tobacco was their number one cash crop. So I've really focused on, how do we help our patients as well as help nurses? Because, nurses and providers like respiratory therapists were notorious for not looking out for their health related to smoking. But a lot of other issues too, as we think about how the American Nurses Associations and our states really want to make sure that nurses have a healthy and ethical practice environment. That also includes things like making sure that nurses have good schedules and that they're not doubling back and they're not working too many hours. And there's no such thing as mandatory overtime as a staffing strategy. And so we have come a long way in terms of nurses believing that they must always, do what they're told, as opposed to really questioning and saying, we need to be part of this decision because it's important to us to have a work environment that we feel good about, that's going to retain us in our jobs and that will keep us healthy and safe. So when we think about more current day changes, safe patient handling and mobility, again, has been a big emphasis. When I was a student and a young nurse, everyone thought that body mechanics was the answer. Well, today we've learned that that is totally false, and that everyone from the biggest burly moving and lift team person to the tiniest nurse can suffer all kinds of injuries, and our patients suffer injuries. Nurses are the fourth highest occupational group that loses time from work from workplace injuries. And so that is a significant change. Nurses also, over the course of those 41 years, I believe, are much more involved in decision making in their organizations. And that to me is probably one of the best changes. Some of that has been enabled by understanding the principles of the magnet designation and really looking at what is it that kept nurses in their organizations and prevented that turnover. And it is the environment where you're surrounded by an organization that supports a culture that is healthy, that supports, again, nurses being involved in designing and having a say in their own destiny, particularly through models like shared governance. Having practice be based on evidence and really striving for excellence in everything we do. So I think we've had a huge maturation, in part driven by more education, more research, and the efforts of all of our professional organizations, ANA and our states and others that have really pushed to bring nursing into the forefront.
Thank you. So many of these issues are systemic issues in nursing culture. And as a nurse, part of what I do is I teach mindfulness and emotional intelligence to individuals and groups. And I guess one of the things that I wonder about is that we are, as nurses, trained and conditioned in so many ways to be other-oriented. It's sort of what we're about. So what is your take on the role of self-awareness and being able to look at each one of our own, who we are as people, and taking responsibility for our health and well-being? What role do you see that playing in Healthy Nurse, Healthy Nation?
It's really a big role. So, Camille, I think you're right on target, which is nurses must take care of themselves. And we look to our code of ethics with interpretive statements for nurses as the foundation for this belief. And we say that nurses have a duty to themselves as well as others, because we know if a nurse is not healthy, they cannot provide the best care. And so it's really important that nurses internalize what we've been teaching patients for decades, which is to take care of themselves or to follow the advice of their healthcare professionals. So this is a time to really turn that back inward to nurses to say we have to practice what we preach. And again, we have more tools and we have many more opportunities for nurses to practice self-care. When I think about the policy that ANA revised 2 years ago on fatigue, we called for working together with our employers to say nurses really do need their breaks and they need their meal rest periods, and they should have a place for respite, and their employers ought to work together to say, what are the programs? Is it mindfulness? Is it meditation? Is it yoga? Is it other exercise outlets? Is it fresh air that individuals can get access to in addition to other things like healthy foods in the workplace? So it's really important that nurses not only recognize and seek these activities and opportunities, but recognize that it is essential, and they have every right to have opportunities to seek advantage to them.
That's very well said, Pam. That's really wonderful. And in the past, I've written about the archetype of the nurse martyr. And I
agree with that.
I think we know that archetype really, really well. Maybe I'll write a book about that with Camille. What new archetype would you like to create for nurses? The Healthy Nurse, Healthy Nation is a great start, and it'll be very successful, I'm sure. And what would you like to see the new archetype to arise from this type of initiative?
Well, first, let me comment, because I use that same analogy of saying no martyr. I don't want any martyrs. And the example that I typically use is the 12-hour shift, which is a little bit of a sacred cow in nursing. And so we know that nurses should not be working more than 12 hours in a day. And yet we hear this constantly. I don't want to give up 12-hour shifts. And yet we know that the literature says once you've reached that 12 hours, not just in nursing, but in other fields, your cognitive ability declines. So therefore you're more prone to errors, and you're also more prone to injury. Nursing owns the 12-hour shift dilemma, because at the same time of the 12 hours, we hear the martyr. Oh, I had to stay after to document. Oh, I didn't get my lunch break. Oh, I couldn't go to the bathroom. To me, that is a self-management and an organizational management issue. So it's up to us to create this new archetype that you're speaking about, which is we must control our environment and we need to make the right choices. Life is always about choices. How we manage our work life is about choices. So whether it's saying, no, I cannot work another shift this week, or no, I really must protect my health because I need my rest, or no, this is a very stressful environment. We must come together to figure out how to stop some of the chatter and backbiting and those kinds of things within my work group. I believe it's not just a culture of awareness, it's a culture of action. And I have always advocated for nurses being very assertive. And I think we're getting better. I know that there are great examples where nurses really do take command and control of their work environment. And if they do it in partnership with their administrative leaders, it's even stronger. So I think that the culture is to say, it's not part of the job anymore. Same thing with bullying and violence in the workplace. It is not part of the job. So as nurses recognize what is it that is the correct norm and how can they make sure that they are being protected so that they in turn protect and take the best care of patients, that's where they need to place their advocacy within their work setting. And they also need to take that advocacy beyond the work setting if it's important to make changes either in state laws or federal laws, like we've been doing for issues like staffing and safe patient handling.
Thank you so much. One of the things that I think about often in nursing that relates to the martyr archetype and what you just spoke about with bullying is also something called the victim, perpetrator, rescuer sort of triangle. And what I've learned about that is that when we are in a victim role, we also flip into the perpetrator role and into the rescuer role. So we think that there's a victim and a perpetrator and a rescuer and that they're all separate, but it's actually a dynamic that we actually will sort of embody. And I've even thought about on this continuum of sort of a nursing archetype, where on the one hand, you have Florence Nightingale, who we all would aspire to be like, and living her legacy, and somebody like Nurse Ratched from One Flew Over the Cuckoo's Nest. And it's interesting, I worked as a nurse manager for many years, and I actually experienced myself on that continuum. And it was from a self-awareness place, it was really an interesting thing to see that they're all interconnected. And I think when we have the awareness that if we take on the role of the martyr or the victim, we're setting ourselves up to actually be the perpetrator or the bully. And we know that bullying and incivility are such big issues in nursing.
Yeah, thanks, Camille. I think that's a very important point. And let me reflect on an early experience I had as a staff nurse. I was mentoring and orienting and precepting a new recruit that we had. And this was in an intensive care unit. And of course, lots of need for accuracy and swift action. And this woman's name was Deborah. I oriented Deborah. And I think at the time we had about a 6-week orientation. Well, she quit 2 weeks after she had been oriented. And I was devastated because I thought she was doing really well. And obviously we had very high standards. Well, I learned through the grapevine that she was so intimidated. And that would never have been my intent, that whatever I was doing or stating as expectations or giving constructive feedback was all to say, we're all about excellence here. We're all about providing the best care. And never would I have perceived that my approach or conversation with her or anything in any way was intimidating, which is not bullying, but certainly from her perspective may very well have been perceived as that. So that was a real wake-up call to me. So I think there are those kinds of examples where we need to look in the mirror. We need to say, how are we coming across? Are we doing the right thing? Are we treating our coworkers the way we want to? At the same time, nurses need to have moral courage, and they have to speak up if they see or observe or are the victim in any situation like that, where they say, this is not the environment that we want. And I think I would move from courageous to also fearless. I think Florence Nightingale must have been fearless. And that, I think, is something we don't often see today, because there is high risk for individuals who speak out. And I think we see that at all levels. We see that on the front lines with staff nurses, and we see that at the highest levels of chief nurse executives. The more that individual advocates and speaks out for the resources that are needed for the autonomy of the nursing staff, the more they are vulnerable if they're not in an organization that really values the expertise of the nurse. And so we have to be aware of all of these conditions all of the time. And again, as you said, I think making sure that we know where we are placed in that triad at any given moment so that we're not the perpetrators of any kind of negative activity or conversation, because it's so destructive. We want to be on the positive side.
Thank you so much, Pam. So one more question for you. You sit in a unique position. What are you hopeful about and what are you concerned about in general for the nursing profession?
I'm really hopeful that we are continuing to gain recognition on the national scene. And that's in part because we are gaining that same recognition in our states. And I see that in a variety of arenas, our local communities, our state legislatures, and sometimes our local governing groups as well, but also recognizing that nurses are influential in really bringing the mission to the people. We want everybody to be healthy. We want to make sure we are providing healthcare that is meeting needs and helping people not only cope and get better from an illness, but having a really good quality of life. We have seen ANA rise in stature. Groups like Forbes have said, ANA is a growing political force in this country. That's really affirming. So that's really satisfying to me. That's where I want us to go. I want us to be in a position where people say, I have to ask a nurse, what direction we need to go in healthcare, because they really know. Now, what frightens me, though, is that we always risk complacency. That, I think we got a little less active over the last 8 years of national health policy because our beliefs were very much aligned with the previous administration. And so now we see we're in the fight of our lives for the people of this country to be able to have access on affordable insurance for care. And I don't want any nurse to be on the sidelines. And even if we don't agree on the strategy, let's talk about it and let's come together, because we do have the mutual goal of wanting to do what's right for the American people in our community, in our state, and nationally.
Well, Pam, you're an inspiring leader. It's really inspiring to meet you, and we're so lucky to have you at the head of the ANA, and very, very lucky to have you here in Santa Fe with us on Florence Nightingale's birthday and the end of Nurses Week. It's really an honor and a privilege, and I think Camille and I could talk with you for hours, and maybe we'll have time to chat more later, but there's more people for you to meet and a keynote to give. So thanks very much for having this conversation with us.
Thank you, Keith and Camille. It's my pleasure to be here.